Okay, thanks for sticking with us. We've got a few loose ends to tie up here. I feel like we started a few conversations that didn't get finished. Before we do that, let's check in with Ed. What was kind of the theme tonight, if there was one, more than one?
You know, a lot of people are saying they're learning things that they did not know, which is, I'm not trying to say that
No,
to
check. That's
check
good.
that off the list there.
That's good.
But,
That's good.
you know, these are for sure some comments, I think, themes. A lot of people saying economic issue, social justice issue, health insurance affects everybody. And then I'm going to follow that up. One person, Chelsea, said, too rich for Medicaid, too poor for Marketplace. Some of the themes in there, you know, people are feeling that push and pull.
You resonate? Does that resonate with you there? We barely touched on your story.
It absolutely does. I cannot express the stress of not being able to access health care. And that is amplified when there are people sitting in Jefferson City who are elected to serve the people of this state, and they refuse, because of their political party line, to offer people health care that can save their lives. There is not a word to describe what that feels like and the stress that it adds to an already stressed body and mind.
We were talking before too, the ACA really, when it was constructed, I don't think they ever thought that there would be pieces that would be taken out. Right. It wasn't designed with redundancy or flexibility. It counted on each piece being there in different spots. And so when you had a Supreme Court ruling that said, oh, this piece is optional, there's holes in the law now where it's just not consistent. And yeah, there are groups that if you're sitting right in the middle there, you get left out.
No, sorry, I didn't mean to interrupt you. But I think that even with the Supreme Court decision, I think there wasn't a thought that states would turn down basically free money. I think there was this idea that it's such a no-brainer that they would take the money, or maybe a few states. It wouldn't be 24 states. I think the idea that there's just this huge gap between some states and other states in the United States is astonishing, to me at least, and I'm sure to a lot of other people. Jen, I know,
and I just have to interject
to
say, of course, I've talked to a lot of people who point out that that's not free money. I don't know the exact percentage of what Missouri sends to Washington versus what we get back, but nevertheless, those are tax dollars nonetheless that come from the states.
But now those tax dollars are going to another state. That's the important thing. We would get $1.5 to $2 billion if we expanded Medicaid, and since we aren't expanding Medicaid, it's going to California and Wisconsin and Minnesota. So those are dollars we're just turning away.
Are we just turning away? Are we losing some others as well? In terms of when you look at the big picture and the resources?
It's even worse than that, as Rob, I'm sure, can speak to, because, you know, there are cuts in the bill that were there, you know, as was pointed out. It was never anticipated this would happen, so there are cuts to disproportionate share payments, there's cuts to hospitals, there's cuts to Medicare providers that are still going to go into effect, but yet we're not getting that $1.52 billion to counteract that.
Always.
And so the hospitals and safety net providers are going to take those hits, but they're not going to get the dollars which were supposed to counteract those effects. So we're kind of definitely within a rock and a hard place at the system level as well as at the person level.
And we end up with even fewer safety net providers for people.
Say that again, the boom was over there. Sorry.
And then we end up with even fewer safety net providers for people who are uninsured. You know, as a community and as a state, the decisions that we make reflect our priorities. And as everyone has said, health insurance is critical. It does save people's lives. And we have to remember, to me, you know, at the end of the day, this is about people's well-being and about their lives. And that means if people can get access to plans through the marketplace, we need to get them the information they can, encourage people to be patient, try again, and we've got to pass Medicaid expansion for the people in this state who are relying on it.
I remember when those people don't have Medicare expansion, you know, those costs come back to haunt us later on, right? They'll at one point end up in the emergency department with nobody able to pay for their care. They'll go to places like BJC and they'll have the complications of diseases that would cost very little to treat now, but we're going to cost a whole lot in the long run. Or if they have really untreated hypertension that may cost pennies today, and that develops into a stroke down the line, that may be a $20,000, $50,000 hospitalization. And these are catastrophic costs that really build up.
You're acting as if the stroke doesn't get treated. If somebody has a stroke and they end up in the hospital treats them and stabilizes them. So those costs are already built into the system right
and they're
now.
shifted to us who have insurance, and that's
And
the
that's
point
exactly
that's
right.
making. And so the point is, we're already paying for this. You know, the
But-
estimates are $500 for a person or $1,000 for a family. So to Casey's point, you know, we're already paying for this.
We're-
So
it's
why
already
not? Why not redistribute it better?
It's
So-
already built, the costs are already built into the system. We're already paying for it through increased insurance premiums. All
Mm-hmm.
we've done is added several middlemen, and we have multiplied the cost by a factor of 4 or 5.
I'm not sure I agree with that, but I
Well,
think
let me tell you
but-
just exactly, because the young gentleman who they did the piece on there was talking about the $94 that he was going to have to pay after the subsidy. He could buy a policy today for $60.
Would it cover what's going to be in the new insurance
Yes.
plan? I don't think so.
Yeah,
but-
that is not true. You do not know what those plans cover. And if he bought that plan today, he would have better coverage than he's going to have in 2014.
He would. You mentioned he. That's one important thing I want to point out. It's a male. But what about a female? What about somebody who's 50 years old and has an illness?
And
That's
every-
part of what this bill is part of.
could you write-
to spread those costs around
I'm
other
here
people.
right now. I'm here right now with a condition, with a diagnosis that, thank God, I have not had a recurrence of cancer yet. But because I have Gateway to Better Health, I can have those tests. I can't afford to get into an exchange. So what we're really talking about is Missouri gonna sit by and watch its citizens be sick and dying? That is what will happen. If I do not know that this cancer comes back in my body again, if I don't have a way to know that is happening, I will die. That's the bottom line.
And why did you lose your insurance in the first place?
My employer could no longer afford to pay for it.
Right.
And I could
think
not
if you
afford to
think
pay
there's
for
also
If
it.
it was
stigma,
expensive before, it's twice as much. One of
I
my
went to
clients,
the exchange
one of
and
my
I
Spread
put
over
in
more
what
people.
my salary would have been, if I were at full salary, what it would have been and what I would have been able to pay on my full salary. I would have been able to do that.
And I
So
think
it wouldn't have been more. It would not have been more. It would have been a benefit to me, and it would have been less than what I was paying with my Cadillac insurance when I was first diagnosed.
I think there's also an underlying conversation that we don't have around Medicaid is there's a stigma against the people, whoever we think those people are, who are on Medicaid. The reconception now is that Medicaid is going to be for a whole host of different people who are transitioning, people who need long-term insurance, and that is going to be, should be available for people in Missouri who need it, and that's the underlying conversation. It's not the economics, or it's not the, is Medicaid good or bad? It's, there are people who need this, and there are gonna be all different types of people, so we shouldn't stigmatize them and we shouldn't pigeonhole them. We should say, these are people who are citizens with us, and they need something, and they are hardworking people who pay taxes as well, and they should get a benefit from that.
Nobody is trying to deny them benefit. All we're saying is there are better ways to price the plans or the coverage for them. You could
But I think
you
that
could
addresses
tag.
the private insurance issue, not the Medicaid issue.
No,
Medicaid's
it
an independent issue.
addresses. There are 800,000 people in this state who do not have coverage. If you tax every individual's health insurance policy, which we have a precedent for and has been successful with the pool, if you taxed every individual's policy $110, it would still be less than the ACA plans, and everybody, those 800,000 people would have free coverage. Free. And we wouldn't have to go through this mess that we're going through right
Is that
now.
something people are talking about doing? Is that one of the options the Republicans are
It's
talking about?
not,
at the
but
state?
nobody, everyone.
So why not?
I feel sorry because everyone has.
No one wants to
has.
be taxed
Hey,
more.
Plan.
Everyone has a horse in this race, and they want to protect
been-
their little area.
We've been waiting 100 years for an option to provide universal coverage, and you know,
Who is we?
in the United States, people who are
The
uninsured.
United States has not been waiting 100 years for
Absolutely
We
that.
started with Teddy Roosevelt in 1915 when he was the first to talk about universal coverage, and it wasn't passed until now, 2013 or so.
The most
So-
successful healthcare delivery systems in this city are SSM and Christian hospitals. Both
For
of
those
them
who
were-
have coverage.
No, both of those were set up for free. It was the sisters who set up SSM. They did it to take care of smallpox victims after the Civil War. The Christians were set up by a women's
So the
auxiliary.
answer you're saying is charity
A women's
care. So
auxiliary
people need to get
who,
charity care.
who raised the funds, had land donated so that they could serve the poor. And those systems were very successful. Now, why can't we
So you
use
wanna have a-
those as an example?
So we want to have a
But I think-
perpetuation of the...
As an example.
I think you have to put it within a context, because what we're talking about is a historical context of 100 years versus now, where costs for healthcare has just astronomically gone through the roof. So some of the conversations that we're having aren't germane to what we're talking about today. Of course, what you're saying, with me being a pastor, I can sympathize with that. However, the issue is that if we were to do that today, I could barely get a flu shot. And it will not suffice for what I need to have long-term as far as healthcare is concerned. I think that, though, there has to be somewhere in the middle, some type of balance, because honestly speaking, the Affordable Health Care Act does have some issues that really need to be addressed. The unfortunate reality is we've made it a political football rather than a human issue that needs to be addressed. And if we were to remove the layers as far as, well, this is President Obama, because I guarantee if George Bush had done this, or even if Bill Clinton had done this would be a mute issue. We wouldn't even be having this discussion. That would be taken care of from a legal perspective and from a tax bill perspective. But since it's Obama, and since I'm here and I am who I am, the issue is race, and the issue is political. Yes, it is. Oh no,
Have
don't
a
please.
discussion
No,
without
no,
injecting
no, because we
race
can't.
into it?
Because we can't.
Which part
We
are you
can't.
talking about?
We can't.
Are you
All
talking
of
about
it.
Obama? Are
All
you talking
of it.
about
See,
Obama's
well, there you
mother?
go. Obamacare. It's
Are you
affordable.
talking about
the
Obama's
proper
mother,
name
or are you
is
talking about Obama's father?
The proper name is
one?
affordable health care.
Which
the
parent
proper
are you
name is
talking about?
affordable health care.
There's a
Let
good.
me, let me help you with this.
The proper name is
I
affordable.
walked
Maybe
into a
maybe let her-
conversation.
yeah.
I walked into a conversation with a Missouri state senator. His words were, "We cannot continue to give people things for free because they don't know how to build character. And without building character, they'll never work."
And
I had to say to him, "Excuse me, but I get up and go to work every day, 10, 12 hours a day sometimes. I don't know who you are referring to, but I am not one of those people. And you not expanding Medicaid means that you will effectively kill me." The people he was referring to are black people in Kansas City and Missouri, who he will let people he represents in rural Missouri be sick and dying because he does not want black people to receive health care. That is insane. It is inhumane. No one in this state, black, white, red, yellow, whoever, should have to live in fear of not being able to go to a doctor or have medical treatment because legislators sit in those state seats and won't expand Medicaid. That's the central piece that's missing, the humanity of the people sitting in the state legislature. People in this state will be sick and dying if Medicaid is not expanded.
And the perception is-
it has to be done in an economically viable manner.
And it has, it's paid for.
Otherwise,
It's
otherwise it
balanced,
will
so.
hurt the people most who need the care the most.
When you
I
can
don't
go to
believe
a
that.
doctor
Is there something that can be done?
You could
Is there-
obviously go to, you are not hurt the most. Trust me, I have lived this for 3 years.
So
Why-
one of the,
why can't-
one of
why
the
can't
points
we-
that needs to be made about this is this bill, the Obamacare bill, Affordable Care Act, whatever you want to call it, is a Republican bill. Everything in it is come from Republican ideas. The individual mandate was a Heritage Foundation's idea. The exchanges came from the Heritage Foundation. This is not a liberal think tank. So where the Affordable Care Act came from was when Clinton plan failed. They said, well, okay, let's start where we ended, where the debate was close to being passed, when the Republicans, Bob Dole and our senator from Missouri, were almost close to finding a compromise. And they said, we'll start with that bill, which is a Republican bill.
So if it was
and so we've
Republican,
passed
then
the
why didn't
Republican.
Nancy Pelosi read it?
She read it. Oh, come on. Her staff read it. So I've read it.
Let me
Have
just
you read it?
interject. Let me just interject this, that we're about to run out of time. So let's, Ed, you started to jump in with a tweet. Did you want to say something that was coming on online?
I just wanted to say that, it affects, I want to go back to that, because people are echoing that what I said before, it affects everybody. I mean,
Not just those looking for
it
the-
absolutely, class issue. it's a ratio issue. I mean, it's not just one thing.
Jen, I cut you off. I'll give you the last word.
All right. I think, we have a history as a country when we pass things. Nothing's ever perfect the first time. We work to make it better. Nobody I know would say that the Affordable Care Act is a perfect piece of legislation. But what we've seen is playing politics with it rather than saying, let's implement it to the best of our ability. Let's get people health insurance through the marketplace, through Medicaid expansion, and then as a country and as a community, we look and we make it better, rather than saying, it's not perfect, so we're not going to sign people up for it now, we're going to let them be sick, we're going to let them die. The solution is get people enrolled now, get them covered under Medicaid, and then we can keep talking about how to make it better.
And we're going to keep talking about this on Twitter. And don't forget 9net.org/health for information about how to navigate what we've currently got. Thanks, guys. I appreciate it. Good job, everybody.